Look me in the eyes and listen to this urgent truth. Your erectile dysfunction is the first, most silent symptom of a vascular crisis that could kill you. If you ignore it, your life won't just lose its passion, it could change forever. What's at stake is your cardiovascular health and ultimately your longevity. Today, millions of men, especially those over 50, face this crisis: the inability to achieve adequate rigidity. This attacks self-esteem, generates anxiety, and destroys relationships. Its name is erectile dysfunction, and it's far more serious than you dare admit. In this video, with real clinical cases, I'll reveal the scientific truth about the connection between your erection and your heart. I'll give you practical solutions and the protocol we use in the clinic to reverse the problem, and in the process, protect your heart health. Stay until the end. What you learn here can change the course of your health, starting today. Welcome to the Adult Health Institute. I'm Manuel Granada, an adult care specialist with a Master of Science in Biomedical Sciences. I've dedicated my career to understanding the mechanisms of the male body, focusing on sexuality, cardiovascular health, and aging. Remember this: these tips are evidence-based, but should be discussed with your doctor or urologist before making any changes. Never self-medicate. Now, let's break some taboos with science. Section 1. Early warning signs: erectile dysfunction and the heart. Erectile dysfunction is the inability to achieve or maintain an erection sufficient for satisfactory sexual intercourse. In 80% of cases, it's not a psychological issue. It's an organic failure of the vascular system. An erection is first and foremost a blood flow event. The arteries must open, dilate, to allow blood to flood the penis, and the veins must close to trap that blood and create rigidity. Here's the key: the principle of arterial phase shift. Think of it like a plumbing problem. The arteries leading to your penis are very small, 1 to 2 millimeters. The arteries leading to your heart, coronary arteries, are larger, 3 to 4 millimeters. What does this mean? Plaque made of fat and cholesterol, atherosclerosis, will clog the smallest arteries first. A small amount of plaque, which barely bothers your heart, is enough to completely block the arteries in your penis. That's why erectile dysfunction isn't a disease of the penis. It's an early sign of arterial disease throughout your body. Erectile dysfunction is the sentinel indicator. Studies show that erectile dysfunction appears, on average, 3 to 5 years before a major cardiovascular event, a heart attack or stroke. It's a gift of time. Your body is warning you that you have a plumbing problem that you need to fix before the main pipe bursts. Section 2. How an erection works and fails. To understand how to reverse it, we need to understand how it works. Don't worry, we'll make it easy. For an erection, you need precise coordination between the brain, nerves, hormones, and blood vessels. 1. The brain sends the signal. 2. Nerves carry the message to the penis. 3. When the green light arrives, nitric oxide is released. This is the gas that relaxes and opens the arteries of the penis. 4. Blood rushes in. And that's it. Nitric oxide is produced in the endothelium, the inner lining of all your arteries, those of the penis and those of the heart. Testosterone is also key, not only for desire, but because it helps keep these blood vessels healthy and allows nitric oxide to function properly. From age 40, testosterone levels begin to decline, and if they drop too low, the arteries don't open properly. If you have erectile dysfunction and low testosterone, your body is sending a double warning signal. Section 3. The 4 Horsemen of the Vascular Apocalypse. The risk factors that cause erectile dysfunction are the same as those that cause heart attacks. We call them the 4 Horsemen of endothelial dysfunction, damage to the lining of your arteries. Horseman 1. Hypertension, high blood pressure. Chronic high blood pressure damages and hardens the endothelium. It's as if your pipes lose flexibility. This prevents them from releasing nitric oxide and opening up. Horseman 2. Diabetes mellitus. This is the most destructive cause. Diabetes attacks on 2 fronts. High glucose damages the arteries, clogging them, and also burns the nerves, preventing the erection signal from reaching them properly. Horseman 3. Dyslipidemia. High cholesterol. Cholesterol and triglycerides are the tartar that forms plaque. They are the physical blockage that clogs the arteries of the penis. 4. Horsemen 4. Obesity and metabolic syndrome. Belly, visceral fat, acts as a factory of chronic inflammation that attacks your arteries. In addition, obesity lowers your testosterone levels, creating a vicious cycle. Section 4. The 3-step protocol for recovery. Treating erectile dysfunction in a man over 50 should be a treatment for longevity. We're not just looking for an erection. We're looking to restore the vascular health of the entire body. Step 1. The complete diagnosis. Never begin erectile dysfunction treatment without a cardiovascular evaluation. Your action plan with your doctor should include medical history. Be honest about the quality and frequency of your erections. Critical lab tests. Cholesterol profile, HDL, LDL, triglycerides, glucose and glycated hemoglobin, HbA1c, to rule out diabetes, total and free testosterone, measured in the morning. Vascular evaluation, the gold standard. Request a penile Doppler ultrasound with medication. This test measures blood flow in the penis. This is the most accurate way to determine if your problem is arterial, blood isn't entering, or venous, blood is leaking. Step 2. Smart medications, the pills. The most common solution is phosphodiesterase type 5 inhibitors, or PDE5 inhibitors. You may know them as Sildenafil, Viagra, fast-acting, 30 to 60 minutes, Tadalafil, Cialis, long-lasting, up to 36 hours, offering more freedom, Avanafil, Spedra, the fastest-acting, 15 to 30 minutes. How do they work? These pills do not cause an erection on their own. You need to be sexually aroused. What they do is help nitric oxide, the gas that opens the arteries, last longer. This results in a stronger and longer-lasting erection. They also have an added benefit. They help blood vessels throughout the body, including the heart. Warning: never use these pills if you are taking chest pain medications called nitrates. The combination can lower your blood pressure to dangerous levels. These medications help 7 out of 10 men and must be prescribed by your doctor. Step 3. The advanced arsenal. Rescue therapies. If the pills don't work, common in severe diabetics or after surgery, we move on to rescue therapies. 1. Intracavernous therapies. Injections. A medication, alprostadil, is injected directly into the penis. It sounds intimidating, but it has a success rate of up to 85%. It guarantees on-demand erection. 2. Vacuum devices, VEDs. This is a mechanical therapy, a pump that creates negative pressure and forces blood into the penis. A ring is used at the base to maintain it. It is very effective and key in penile rehabilitation, for example, after prostate surgery. 3. Regenerative therapies, the newest. Low-intensity electromagnetic wave therapy, LI-ESWT. This is the most promising therapy. Acoustic waves are applied to the penis to stimulate the formation of new blood vessels. It is an attempt to heal damaged tissue, not just treat the symptom. Platelet-rich plasma, PRP, and stem cells. Still in advanced research, these therapies aim to regenerate damaged nerves and arteries. 4. Penile implants. For severe and intractable erectile dysfunction, hydraulic implants are the definitive solution. They have the highest satisfaction rate, over 90%, and guarantee the restoration of sexual function. Section 5. Real clinical cases. I have seen how these protocols change lives. Here are 3 real cases. Case 1. Juan, 59 years old, diabetes and shockwave therapy. Juan, a poorly controlled diabetic, no longer responded to medication. His Doppler ultrasound showed severe vascular damage. Intervention. We referred him to an endocrinologist for strict blood sugar control and began a shockwave therapy protocol. Result. After 6 sessions and with his diabetes under control, Juan regained spontaneous erections and recovered his response to low doses of Tadalafil. We rejuvenated his endothelium. Case 2. Pedro, 63 years old, prostate cancer and rehabilitation. Pedro underwent surgery for prostate cancer. The surgery saved his life but damaged the nerves, causing severe erectile dysfunction. Intervention: we initiated aggressive penile rehabilitation with a vacuum device, VED, twice daily to oxygenate the tissue, and low-dose injections. Result: within 8 months, the nerves began to recover. Pedro successfully transitioned from injections to pills, regaining his intimacy and self-esteem. Case 3. Mario, 55 years old, hypertension and lifestyle. Mario, a sedentary executive with hypertension, was not responding to medication. Intervention: I reviewed his medication. He was taking a diuretic that can affect erections. We spoke with his cardiologist and switched him to an angiotensin II receptor blocker, ARB, which is more erectile friendly. He also started aerobic exercise, brisk walking, and a Mediterranean diet. Outcome: within a year, Mario's blood pressure was under control, and with the exercise and the change in medication, his response to medication was once again excellent. Section 6. The recipe for longevity. Healing habits. Medical treatments work best when accompanied by behavioral changes. 1. Aerobic exercise, the best vasodilator. 150 minutes per week of brisk walking, swimming, or cycling. Movement forces your arteries to produce more nitric oxide. It's the most natural way to boost your vascular health. 2. Nutrition. The Mediterranean diet. Prioritize vegetables, olive oil, fish, and nuts. It reduces inflammation. If it's good for the heart, it's good for erections. Focus on foods rich in L-arginine, nuts, lean meats, which is the building block of nitric oxide. 3. Weight control. Reduce abdominal fat. Losing just 5 to 10% of your weight can dramatically improve erectile function by reducing inflammation and improving insulin sensitivity. 4. Medication management. Talk to your doctor. Some blood pressure medications, diuretics, or older beta blockers can impair erections. There are modern alternatives, such as nebivolol, that are neutral or even beneficial. 5. No tobacco and moderate alcohol. Tobacco is the worst enemy of the endothelium. It's poison for your arteries, period. Excessive alcohol depresses the nervous system and interferes with erection signals. Section 7. The emotional and relationship factor. Erectile dysfunction is rarely just a physical problem. The psychological impact creates a vicious cycle. The man fears failure. This anxiety releases adrenaline. Adrenaline constricts blood vessels. Failure is guaranteed. Solution 1. Therapy and communication. A sex therapist can break this cycle, but the most important thing is to talk to your partner. Your partner needs to understand that this is a vascular medical condition, not a lack of attraction. Solution 2. Mental health. Chronic stress and insomnia raise cortisol levels, which worsens erectile dysfunction. Prioritizing 7 to 9 hours of sleep is a powerful therapy. Section 8. How to prepare for your doctor's appointment. Your role as an informed patient is crucial. Be proactive. 1. Be detailed. Keep a record. When did it start? Is it always or sometimes? Are there morning erections? A good sign? 2. Medication list. Keep a list of everything you take, including supplements. 3. Ask about your heart. Explicitly request a cardiovascular evaluation. Insist. Doctor, I'm concerned that my erectile dysfunction is a symptom of my heart. 4. Ask about alternatives. Ask about all the options: pills, shockwave therapy, injections, and which one is best for you. Sections 9. The future. Briefly, urology is undergoing a revolution. We are moving from on-demand therapies, pills, to regenerative and curative therapies, like shockwave therapy. New molecules, gene therapies to repair nerves, and personalized medicine are being explored. But the solutions I've given you today are the ones that work and are proven. Section 10. Reflection. My message is one of hope and urgency. Erectile dysfunction is not the end of your sex life. It is, quite literally, a life-altering warning that gives you the opportunity to correct problems at their root before they become catastrophic. Taking action on your erection is taking action on your heart. Don't settle. Don't let shame cost you your health. Modern science offers real solutions. The first step is the hardest: talking openly with your doctor. If this video gave you the clarity you needed, help us spread this vital message. Like this video. Subscribe to the Adult Health Institute for more science that will extend your vitality. Leave your questions in the comments. And go watch our videos with scientific evidence to change lives. Your participation can save other lives. Thank you for your trust. Start your change today.